Welcome to Washington in Focus. I'm your host, Christian Russell, alongside the Center Square's Tim Clouser, here to discuss Spokane Stabilization Center having a $500,000 funding gap and the city's plans on how to manage that. Tim, thank you for joining us, and why don't you tell us what's going on?
Yeah, so just to get started, this is a county center, though the city does utilize it as along with all of the cities in Spokane County pretty much. But essentially, the county in 2021, they opened this regional stabilization center, which is essentially this diversion tool where if you have people that are homeless and using drugs or otherwise on the street and constantly in crisis, interacting with emergency medical services or law enforcement, instead of say arresting this person on the corner for using drugs or overdosing, sending them to jail or the hospital to detox and then being released a few days later or maybe even that same day, law enforcement and emergency medical responders can pick these people up and take them to the regional stabilization center, which is a county resource, but a lot of the jurisdictions within Spokane County pay into it, including the city of Spokane. But it essentially saves room at the jail and the hospitals. So you're not paying for probably a more expensive detention in those spaces or the services that you might get through a hospital. But at this regional stabilization center, they're connected with services. So you get there, you can detox, and then you can get connected with mental health support, treatment support, and housing services. So the project has been pretty successful since they started it in 2021. But it's funded through a mix of state, federal, and local grants and like opiate settlement funds that a lot of cities and counties across the nation have gotten. But a lot of this is short term funding. Yeah, there's some reoccurring sales tax revenue that's in there, but um, they're facing a situation where essentially their costs are going up. They're having a hard time hiring qualified people, so they're having to pay more, and that's resulting in about a $500,000 shortfall for them. And that's just in the first 3 months of 2026. Christian, last year they had uh, it looks like they said it was about $450,000 shortfall in 2025. That's for the entirety of 2025. We're talking about a $500,000 gap right now, just between January, February, and March 2026. So they're asking the county to plug this whole short term and said that it's just going to be a one time thing. And that they're hoping that negotiations between medical providers and the state when it comes to Medicare funding or Medicaid funding, that those rates might go up and fill the gap in the long term. But right now they're really banking on the county to step in and say, "Hey, here's some extra money now. Let's keep the doors open."
Well, yeah, and now their budget went from just about 8.5 to now 11.3, nearly $3 million increase in 2 years. You touched on that a little bit, but what's that attributed to? And then what are the plans outside of a short-term funding gap? Like if it's going to keep going up in cost for running this, does the city have any inclination on how they're going to handle long-term growth in terms of the cost for running this project?
Yeah, so there's a few things that go into that. So, Pioneer Human Services, they're the company or the organization that operates the stabilization center, and they had some staff present to the county commissioners yesterday, or not yesterday, sorry, earlier this week. And they essentially said that the main thing that they attributed to the cost was a labor shortage, and they put the number. I got them right in front of me. Hold on here a second. They said the for 2025, the labor shortage cost them about $267,000. And then for the first 3 months of 2026, about $249,000. So about half of their delta for 2026. But the year's only going to go on. And essentially, he just said that the pay that they're offering to certified nurses and these other positions that they have to hire for this regional stabilization center, that these nurses could be hired for a hospital or these different types of services and get higher pay. So it's hard to hire people when you're not paying the same as the market rate in the area. So they're having to pay more in order to get these people, or they're just having to decrease services a little bit. So that's the main thing they're saying. The labor shortage is contributing about half of the current shortfall. And then they attributed the rest mostly to rising costs, which a lot of organizations have felt across the nation. I don't think it's entirely surprising to see that their spending has gone up in the first 3 years, especially considering that they just opened in 2021. But it does raise the question of, is this sustainable in the long term? And they're just going to have to look at, how are we going to do this? I mean, they have a few different sales taxes that help fund this. I mentioned the opiate settlement fund, but there's also other services in the county. For example, I always get this name wrong, but I have it written down in front of me. There's Spokane Treatment and Recovery Services. They call it Spokane Stars a lot of the time. It's essentially this detox center, and the county has leaned on it a lot in the last 2 years, and it's had fairly great success in terms of moving clients through and helping people and connecting people to other services and getting them into treatment. Um, but now the county is building this new detox and sobering center as part of an expansion to the crisis stabilization center, the regional stabilization center. So the county's plan over the long term, they're looking at this, is to transition money that they put towards Spokane Stars, this other service, and then transitioning that funding to this new facility that's going to be an expansion of the regional stabilization center. So technically, they have two different names, but the goal starting next year in 2027 is to lump the regional stabilization center and this new sobering center under one contract, and then to transition the funding from Spokane Stars over to this.
So now, is there going to be any additional funding requests from taxpayers if they're talking about expanding and then uh, consolidating programs? You mentioned, sales tax, the opiate relief funds, but is there going to be any? Is there anything in the works possibly for additional funding from taxpayers?
Well, they didn't talk specifically about raising taxes or implementing any new fees. It was mainly transitioning funding from one service to another service, and then hoping that the state and the federal government will step in. And there's these upcoming reviews with these Medicaid providers, so that possibly those rates will go up, and then the county will see a little bit more return from that in terms of paying for a lot of these people who are uninsured. Um, so that's where that comes in. But it doesn't look like taxpayers are being asked to pay more necessarily for this, but it's definitely something that the county will need to keep an eye on moving forward. And then uh, the goal in situations like this is that when you have services like this, you're able to get on top of a growing problem. And that really has been homelessness and the fentanyl epidemic in Spokane the last few years. So the goal is that with services like this, you'll see the numbers go down, and maybe you won't need a service like this as much. But right now, there is a very clear need. They've served over 4,000 people since the facility opened in 2021. I believe right around 450 people or 550 people alone in the last 3 months, the first quarter of 2026. And with those people, you're seeing about 80% of them reporting better mental health and recovery, and about 80% also getting connected with housing services. So you're seeing quite the return. But yeah, there is a trade off with taxpayers stepping in to fund part of this. And when we talk about state, federal, and local grants, what that means is tax dollars. I mean, federal, state, government grants are tax dollars. We pay sales tax, property taxes, these other fees, and then the government is able to take those and then pay for their own obligations with them. And this is one of those.
That money's gonna go somewhere, and this is
Yeah.
where the city, state, counties are deciding to put the money. And then lastly, real quick, comparing costs to say like housing first initiatives, um, how would you say from a taxpayer perspective, things like the stabilization center, which seems to, from the numbers, have some moderate success versus housing first policy in terms of cost and then actual impact for the homeless crisis that we face here in Washington. How would you say those two juxtapose?
Well, there's a little bit of gray area right there, because when we talk about housing first, we're generally talking about services where there's a low barrier service. So basically, I'm going to go to this homeless shelter, and they can't require me to be sober or participate in treatment to be there. that would be low barrier or what's called housing first. And a lot of people feel like, if taxpayers are paying for you to stay in the shelter, then you should be required to participate in treatment. The way the state and federal contracts are set up right now, they're largely centered around housing first. Now, under the Trump administration, they're trying to move away from that. And within the next few days, we could see the U.S. Department of Housing and Urban Development issue a new funding availability that could completely do away with housing first. They tried that last year, but a judge blocked it. But that is their direction they're going. Technically, the Regional Stabilization Center is a low barrier facility, in line with the state and federal funding policies. But if the Trump administration changes things and says, "Hey, you can't get this money unless you're not offering low barrier services," there needs to be some other conditions there to receive the services. I'm sure that the county will adjust their guidelines and their contracts to comply with that. But at the same time, the Regional Stabilization Center is a largely voluntary service, but people see it. They say, "Hey, they're going to take me to jail or the hospital. Why not just go here instead?" And it's not a long term shelter where people are staying for months and months and months and not moving out, and then they're leaving during the day to use drugs and coming back. You're seeing a lot of people being connected with services. So there is an argument that, maybe people are being held more accountable here. But I think it's obviously, we're seeing some success with the project. I mean, they're expanding it and building the sobering center. That alone is going to be around $21 million, I believe, to build. So they're making major investments. They're seeing a return on the investments. It's just a matter of, you have this one facility that's countywide. Yeah, there's a lot of homelessness services scattered throughout Spokane County. But this is one great service among many. So they're trying to replicate the effort in a way without letting costs run away from them.
Well, Tim, thank you for your insights into this. And if viewers and listeners, readers want to learn more about this and everything else going on in the state of Washington, please visit thecentersquare.com and also stay tuned to Washington in Focus to get everything you need to know about the great state of Washington. Tim, thank you again.